Huskies and friends, how are you doing? No, let's do a little temperature check. How are you really feeling? How are we managing the winter? I'm gonna keep it all the way real with you guys. I do not like the cold one bit, and it is extra nippy outside. We're also getting into the serious part of the semester. You probably have an assignment or two due, right? I know, guys, it's time to lock in and get the work done, but as usual, we're here to remind you that it's all about balance and keeping you in the loop about how to make the best of your student experience. Now, I know this weather brings a lot of things with it, and one of them tends to be the flu and other respiratory illnesses. So we do encourage you to eat right, sanitize, and wear a mask if necessary. But we also want you to always prioritize your health. This week, we're talking Student Association health plans and how they can help you as a student to have access to the best healthcare you need. We spoke to Luna Seracero from the Student Association Health Benefits Program to learn about what health benefits George Brown students get when they enroll and pay their fees.
Hello, everybody. My name is Luna Seracero. I work at the Student Association for the Health Benefit Program. I'm very happy here today to talk about all the services that we offer. We make sure that all the students that enroll and pay their fees, international student or domestic students, are covered with one of our 4 different plans.
She broke down the different health plans available, the main plan, which everyone is automatically enrolled in when they start the semester. That one is the balanced plan, but there are also more enhanced plans that you can choose instead if you wish.
When you pay your tuition, you are actually automatically enrolled into the balance plan. And you do have an option to change to any of the other 3 plans that we have: the enhanced drug plan, enhanced dental plan, and enhanced extended health plan. All our plans do cover the same major subcategories. That will be prescription drugs, dental, extended health, and vision. However, as the name indicates, the percentage on the year maximum is redistributed according to the name. Drug plan, as the name implies, it will have a higher weight when it comes to drug coverage, and dental for dental coverage, and extended health will have a little bit more coverage towards eye care and paramedical practitioners. So if the students wish to change to the other 3 different plans, that is not the balanced plans, they can do so as long as they are in their first semester and they do it within the period that we have to make any changes to the insurance.
That means that if you are starting your first semester now in winter, you can change from the balanced plan to any of the enhanced plans before the deadline.
And the last day to do so will be February 6, 2025.
Aside from the drug, dental, and vision healthcare, sometimes you may need to go to the doctor's office or the emergency room. For domestic students, this healthcare is automatically covered under the OHIP. But for the international students, there is some OHIP coverage included in the International Student Plan, and Luna explains more.
Absolutely. So for international students, when they want to go to a walk-in clinic or a hospital, they are covered with our international OHIP alternative. And so consultations will be covered. International students, after they receive a service, they may be issue a bill that can be sent to the insurance for the insurance to pay it. Or sometimes the students can pay from their own pocket and then submit a claim through our website using the extended health claim form that is in our wespeakstudent.com website.
Also, did you know that you can add dependents to your health plan? I didn't know that.
Dependents are your wife or common law and your kids. For adding your family members, you do have to pay an extra fee, and you are able to do so in our www.studentassociation.ca website, and also you can make changes in the www.wespeakstudent.com.
Check our show notes for all the links. The Student Association Health Benefits Program also has a new virtual pod service this year, provided through the Cleveland, Canada Clinic, and she'll tell you more about that.
I'm also very happy to share that now we have a new service, what we didn't have before, the More Care Benefits and Cleveland Clinic, Canada, which is a virtual clinic in our college. We have the virtual clinic in 3 of our campuses, St. James, Cansaloma, and Waterfront. So what is all this virtual clinic all about? Well, we do have PODS. The PODS stands for Physical On-Demand Clinic. This refers to an in-person location where students can access virtual healthcare services through Cleveland Clinic Canada systems, in particular with a nurse through a tablet over the internet. And so we have some tools that will help the nurse do a thorough assessment. They can take your temperature, can look into your ears. For instance, we have these little like cameras. We have better look at your skin, take your blood pressure. So the nurse can make a better assessment, although it's still online. So we have pods on all of our campuses, and Waterfront campus is located outside the SA office in room 033, open Monday to Thursday. Casa Loma campus is in the Student Association Student Center near the room 103, open Wednesday to Fridays. And for St. James campus and the 200 King Student Association office, close to the room 147H, is open Mondays, Tuesdays, and Fridays.
The virtual pods are on campus, as Luna mentions, but if you can't make it to one of those locations, you can also access the pods online from home or wherever you may be.
It is in person in the sense that you have to attend the college and then use the pods. But again, since it's a virtual service, if you cannot get out of home or you just need to talk to a nurse and you are not in the college, you are welcome to do so by creating an account with Cleveland Clinic. You may contact the nurse through your phone, tablet, or laptop from wherever you are, as long as you have a Wi-Fi connection. Although it won't be without the tools that we offer in our pods, still you can get an assessment and the nurse can provide you with some medical advice, a prescription, a doctor's note, or give you guidance, or should you go to the dentist, or should you just go to a walk-in clinic in case further assessments may be necessary.
The virtual pods by the Cleveland Clinic are a potentially great way to give you more access to quick, non-emergency healthcare without having to go to the hospital or wait all day in a walk-in clinic office. That sounds great to me.
I find like a lot of students don't really find the time to go to the walk-in clinic because sometimes the waits are long and we are at school, or just sometimes going to a hospital thinking that that is the best place to get some medical help if it's not an emergency. A lot of students come with like skin issues and well, they need to go to a walk-in clinic to get a referral for a dermatologist. And sometimes just seeing the nurse, they can tell them to use a little bit of like medicine and it kind of gets better. So, I mean, that's the little things that I have noticed that the students being benefit from in this very short time.
Plus, if you already have a family doctor and you use the Cleveland Clinic instead, there's no conflict of interest with your family doctor. Luna explains this from her own experience using the Cleveland, Canada Virtual Clinic. That sounds like a tongue twister.
I have the opportunity to use the Cleveland Clinic. I wasn't feeling well at the college and I was planning to go and see my family doctor, but he happened to be out for a vacation. And so our services at the Cleveland Clinic Canada is with a practitioner nurse. That means that does not affect if you already have a family doctor. Some you may know if you already have a family doctor and you go and see another family doctor, that may be a reason for terminating you as a patient. They prefer that you just see the family doctor has been assigned to you. But in this case, because it's a nurse practitioner, that is not a problem. And so I went ahead and I used the tools and she helped me prescribing some of medicines because I was having some pain. So it was probably like a 15 minutes interaction. It was very easy to log in, connect with the nurse, and then she sent my prescription to my email. It was a great experience.
And in case you were wondering, the Cleveland virtual clinics are included under your coverage, so you don't have to pay any fee to use it. either at the pods on campus or using the app at home. So next time you think you may need to go to a walk-in clinic but don't have the time while on campus, check out the Cleveland Clinic pods and see what you think. And let us know. We were curious about whether massages and physiotherapy were covered, so we asked more about that.
Yes, actually, there is another good change that occurred in our insurance where massage and physiotherapy coverage increased. Now, students get 80% coverage per treatment. That means per session, up to a maximum of $1,000 per year. So that means that if every time you show up for a physiotherapy session or a massage therapy session, you will get 80% coverage when you're paying, and you'll have to pay 20% difference. However, you do need a doctor's referral to the physiotherapy clinic so the insurance can cover it. And if you're a recurring client already, you still will need to go through the process of getting a new doctor's note that referring you to these physiotherapy clinics so the insurance can be applied.
Yep, there's lots of health services covered in your student association health plan. Of course, if you are already covered under another health plan and you want to opt out, you can do so if this is your first semester.
If you would like to apply to opt out or to opt in your family members, please do so through our www.wespeakstudent.com website. The last day to do so will be February 6, 2025.
So there you go. Now, isn't that a great way to start the semester? Thanks, Luna. I think it's amazing that our fees not only help us to access many amenities on campus, but also things such as healthcare that, as we know, can be very expensive. Personally, I've used my dental plan and that was a life changer for me. So guys, I encourage you that if you've never really paid attention to your student association health plans before, that you stop by the website, as we said, it's in the show notes, and see what you're missing out on. Your future self will thank you for it. We want to be healthy and alive with all the abilities to thrive in 2025. And that starts with a healthier you. So, until next time, from me and my producer Claire, walk good.